So finally, to wrap it all up with the speakers, we have Lisa Morenga, who is, of course, a health specialist who specialises in nutrition. We were just talking about food and whether you put on a community services card or lift the GST off fruit and veg or something. So I'm really pleased to looking forward to hearing what Lisa has to say. Of course, Lisa specialises in Māori health in particular, a researcher based at Massey University, but nutrition in general. And if there's nothing, we're talking about housing. Food is the other critical factor when it comes to dealing with poverty. So, Lisa, thank you.
Tēnā koutou, tēnā koutou, tēnā koutou katoa, ngā mihi nui, ki ngā mana whenua, ki ngā whānau o tēnei whare tapu, ki ngā rangatira I tēnei whare as well. Ngā mihi also to the people on the screen. Hopefully they'll be watching. I feel a little bit trumped in what I have to say after Murray's very impassioned talk this morning about the cost of housing, because at Health Coalition Aotearoa and in our work we know that healthy food is a privilege for people that comes after they have paid their rent, paid their power, and all those other necessities. So unfortunately, encouraging or helping our population to eat the sort of healthy food that we know is going to sustain our population in good health, reduce expenditure on the health system, allow our children to grow and develop, is not a priority for many, many families right now. I have to put my glasses on. Kind of a ramble today. In preparing for this talk, because it was a very busy day, and I also want to say happy birthday to Huhana. I was 51 yesterday, so budget day was my birthday in Auckland. But in preparing, I read the news this morning, and the first story I read was a story about Kaitaia Mama Chantal Puru, who was really proud to be able to feed her whānau of 5 on about $100 a week. Sometimes if things go wrong, she might only have $20 a week left to buy food, but she was really proud to say she didn't rely on people, she didn't need the food banks, that she could make that money spend. And she gave an example of being able to feed her family meatball subs when the breadsticks were down to $1. She could cut a French stick into 4 pieces, put on a little bit of mince and a little bit of budget tomato sauce and a scraping of cheese. A starvation diet. The University of Otago food cost survey, they estimate the costs of diets that will meet the needs, the nutritional needs of families and individuals. Their survey for the most basic diet that has all of the nutrients, proteins, vitamins, minerals that we recommend that people eat to stave off chronic diseases and infections and to grow well, costs a family $273 a week. So she's making do on $100 a week. And all of these things that are quite positive in the budget that have been announced, I don't think they're going to add up to $173 shortfall that she's missing out on being able to feed her family right now. So at Health Coalition Aotearoa, we're not excited by the budget. We're not disappointed. You know, the things are, I suppose we are a little bit disappointed, aren't we all here disappointed? Everyone's disappointed. There's so much more we would like. But we're not doing enough for our families right now. Having said that, that $5 prescription fee that I heard some political parties saying they're going to roll back if they get into power, that they don't think is fair, that will make a huge difference. If you've only got $100 for food, then you can imagine when Chantal needs to go down to the doctors to get her kids some paracetamol because they've got an infection, that that might be an even worse meal that she's left feeding those her kids, and they're going to get sicker and sicker. Cost us all much more money. One of the things that we were really looking for in Health Coalition Aotearoa was we were pushing for an expansion of the ka ora ka ako healthy school lunch program. So currently about 25% of kids, so the bottom 25% of schools in terms of socioeconomic indicators, get the free lunch. But we know from the Growing Up in New Zealand survey that at least 10% of kids at schools who are not getting that free lunch program are living in severe to moderate food insecurity. So they'll be living in households that are getting food like Chantel's able to feed her family, keeps the tummy full, but it's not protecting their long-term health, well-being, growth and development. So we were asking that if there was one thing the government could do right now that would take some of the pressure off families who are struggling to feed their families, could they look at expanding the program to reach more of those kids? That hasn't happened, but we are pleased to see that they've extended it for longer than they had proposed. So it hasn't been taken away, so that is at least a win. And we know from some of the mamas that we've talked to, if you've got 3 kids who are getting free lunches at school, that can make about $60 difference a week to their food budget. So Chantel will be able to buy a little bit better food for her family with that school lunch program. It's not perfect, and I know some of you have asked about targeting. Not all kids in the schools that get free lunches need them, so why should we do that? Well, actually, we think a bit more holistically like that. We don't want to target kids and stigmatise them. We know from overseas programs that when you target just the poorest kids to get those programs, the uptake is worse. Because, you know, it's shameful to have to receive a handout when someone else isn't. Also, the benefits of free lunches extend to all kids, because most of our kids in New Zealand are not really eating the diets that are optimal for good growth and development, and we want those kids to grow up as healthy, productive people who can pay our superannuation, don't we? So we don't want them their working lives cut short because they're unwell from preventable diseases caused by not learning and being able to have access to healthy, nutritious food. So just from a purely selfish point of view, Jonathan's gone, you know, we could just say, look, feeding all of our kids is good for all of us in the world. I just wanted to talk about the GST before I go, so this is kind of answering a question now. Taking GST off fruits and vegetables, this is actually something that nutrition experts often ask for, and it's not something I really favour, because I kind of think of taking the GST off fruits and vegetables as a tax cut for the rich. I buy lots of fruits and vegetables, so, you know, we'd be losing tax revenue. I don't think Chantel here can afford very much fruits and vegetables anyway. She's not buying them. She's not going to get a benefit from taking that GST off fruits and vegetables. So I think that money could be better targeted to support families like Chantel's. And, you know, I'd rather the capital gains tax take the money off the people who can afford it the most. We seem to expect our poorest families to do all the sacrifices right now and make really terrible sacrifices. So I'd like to see a much more progressive budget in the future. Kia ora.
Kia ora, Lisa.
Thank you.